Good day, and welcome to this installment of the BBS Gross Anatomy video podcast series. I am Dr. Stuart Ingalls, and in this podcast, we'll be exploring the structure and components of the brachial plexus. Before we start, I should explain that this podcast is designed to run as an active kinesthetic drawing exercise, with the viewer drawing the structures as they appear on the screen. But it also accommodates passive review by moving at a relatively quick speed. So if you're using this as a drawing exercise, which I strongly recommend you do, by the way, then you're probably going to need to pause the recording at several points to allow you to accurately draw all of the components being described, especially if this is your first time going through it. If you have completed this exercise before and are using this as a review session, you might actually want to consider drawing faster or even anticipating and drawing the structures prior to their appearance on the screen. For most people, this is an excellent approach to learning anatomy, and I hope you make good use of this resource. So, without any further ado, this is the brachial plexus. It's one of the most complex structures you will encounter in gross anatomy. Trying to learn the brachial plexus by studying the big, complete picture can be very daunting. I remember in undergrad having Netter's drawing of the brachial plexus as the wallpaper on my computer for a while in order to learn it. And despite having my girlfriend at the time call me a geek every time she saw it, I was never able to quite memorize it in this fashion. So, let's just get rid of it. Let's get rid of that big, scary picture to start with. We're going to start with a blank slate and put the pieces in one at a time. Please trust me, the act of putting it together from scratch will help you far more in remembering it than starting at a completed picture. So the first thing that we're going to have to do is break down the brachial plexus into a series of components. And we're going to have 5 components really to start with, which are going to be divided up in sections 1, 2, 3, 4, and 5. And we call these different regions of the brachial plexus the root, division, cord, and branches or terminal branches. Now, anyone that's had me as a lecturer knows that I absolutely love using mnemonics to remember things, and the one that's typically used here is Randy Travis drinks cold beer. I guess that requires you to know who Randy Travis is, but it's the mnemonic I use to remember the names and orders of those different regions of the brachial plexus. Next thing that we need to put in are the 5 roots, and we number these according to where they come off of the spinal cord. C5, C6, C7, C8, and T1. So these are the direct branches of the anterior division of the branches off of the spinal nerves, and this is what is going to form the brachial plexus. And as the term plexus implies, what is going to happen is you're going to have a series of converging and diverging between these different roots as they pass through, which is what makes it so complex in the first place. So, first we're going to start by the combination of C5 and C6, and what we're going to notice is that these 2 roots fuse into our first trunk. So they fuse together, and that creates a completed fused trunk. If we look at roots C8 and T1, we find the exact same thing happens. Those 2 roots fuse to form an additional trunk. That leaves C7 on its own, and what we find is that C7 root just continues as its own individual trunk without any converging or diverging. So we collectively call these the superior, inferior, and middle trunks, respectively. Next thing that happens is we get into the divisions. And it's actually fairly straightforward, even though it looks complex. Each one of these trunks that we see is going to have what we are going to call anterior division. But in addition to that, what we see is splitting in each of these individual trunks. They also provide a posterior division. And that's pretty much what's happening at this point. All you could do is think of the superior, middle, and inferior trunk, each dividing, each giving an anterior and a posterior division. The cords is where it's going to start to get a little bit more complex. And this is where we start to lose a little bit of the symmetry we see. If you look, there's symmetry between the upper and lower areas of the brachial plexus. That stops when we get to the cords. So first, what we're going to see is that the anterior superior division and the anterior middle division, they're going to fuse together to form what we call the lateral cord. If we look at the anterior inferior division, similar to what we saw with the middle trunk coming off of C7, it doesn't converge or diverge at all. It just goes along its merry way. And call this the medial cord. It's a little bit complex to understand based on the drawing that I've got, but what you have to remember is I'm trying to give a simple schematic of this. In an actual body, the lateral cord would appear lateral to the medial cord, so they do bend as they go through, and we'll demonstrate this in a couple of minutes. Third, we have the three posterior divisions that we talked about. These are actually all going to fuse together into a single cord, and as you might expect, it's called the posterior cord. Next, we get into our branches. So these are sometimes called the terminal branches, and their names should look familiar to you because they basically take the name of the nerve that they actually become. And the name really doesn't change the entire way down into the upper limb. So first of all, we have off of the lateral cord, the musculocutaneous nerve. This nerve will pierce into the anterior compartment of the arm, or anterior brachial compartment, and supplies all the muscles there. So biceps brachii, brachialis, and coracobrachialis all receive their innervation from musculocutaneous nerve. In addition, the term cutaneous suggests that there is going to be a cutaneous portion to this as well, and that's the lateral antebrachial cutaneous nerve, or lateral cutaneous nerve of the forearm. So what we see is the musculocutaneous pierces into the anterior compartment. The muscular portion of that supplies the muscles there, and then the cutaneous portion continues further on. Before we go any further, I should mention to you that I'm primarily going to be focusing on the muscle function and which muscles each of these nerves supply. But please keep in mind that almost every single one of these nerves has a mixed function. So in addition to supplying muscles, it will also supply sensory information, typically right around the region of the muscle it's supplying. But for more information on that, please consult Netter's Atlas, where you'll find very good dermatomal patterns and patterns of cutaneous nerve distributions to give you a better idea of that. In addition to the musculocutaneous nerve, we now go down and look at the medial cord, and we find that it continues on as the ulnar nerve. The ulnar nerve will continue into the forearm, where it supplies two muscles of the forearm, and then continues down into the hand itself, where it supplies the majority of intrinsic hand muscles. Now, in addition to these two nerves that we see traveling along, we also see that both the medial and lateral cords will give off an additional branch, and those two branches will actually fuse in the midline. And this is given the appropriate name, median nerve. Median nerve continues into the anterior antebrachial compartment, or anterior forearm compartment, and it supplies the majority of muscles there. And then it will continue into the hand and supply primarily the thenar eminence and the two most lateral lumbricals. Next, we got to look at the posterior compartment. We have two branches that come off the posterior compartment. The larger, very prominent one is called the radial nerve. Radial nerve travels through the posterior brachial and antebrachial compartments and supplies all the muscles in those regions. So triceps brachii, all of the extensor muscles that we see along the posterior aspect of the forearm, those are all supplied by the radial nerve. In addition, it supplies the majority of cutaneous innervation along the back of the arm as well. The smaller branch we see is called the axillary nerve. Axillary nerve supplies, once again, some cutaneous innervation, but its muscles that you need to be aware of is the axillary nerve supplies the deltoid and the teres minor muscle that we see along the back of the arm. Now, before we go much further, I am going to put up a couple of other structures just to give you a bit of an orientation of the brachial plexus in situ. Do not draw these next three structures. It'll just complicate everything for you. I'm just throwing them in for the time being so you can take a look at them and understand where they are in relation to the rest of the brachial plexus. But again, do not draw this. It will really mess things up for you. First, we have our anterior scalene that I've put in here. So it lies in front of the 5 roots that make up the brachial plexus that we talked about. And so what you'll see in a cadaver, or if you're doing surgery in a patient, is that the brachial plexus tends to emerge just posterior to the anterior scalene and just in front of or anterior to the middle scalene. So that helps us to landmark and identify the start of the brachial plexus. Second structure I'm going to throw in there is the first rib. So you'll see that the brachial plexus does in fact come out in front of the first rib. And you see how the anterior scalene attaches itself to the first rib in this place. And the final structure I'm going to throw in, and you're going to see what a terrible artist I truly am, is the subclavian artery, which eventually turns into the axillary artery. No, it does not get bigger as it goes through. It's just a reflection of how poor an artist I am and the fact that we are doing this as a schematic representation. So the reason I throw that in there is that you can see the medial cord down here, how it does lie on the medial aspect of the axillary artery. Lateral cord lies on the lateral aspect, posterior is behind it, and that's where these things get their name. They're really named for their orientation with respect to the axillary artery. And as you might expect, the axillary artery, this would be someone that's sort of got their arm up, but in anatomical position, we'd really see all of these structures curving down in this direction. It also helps you to identify the relation in respect to the musculocutaneous, ulnar, and median nerves with respect to that artery. The other thing I should point out at this time is musculocutaneous nerve, median nerve, and ulnar nerve. The best way to find them in the body, and probably the way to really recognize that you're at the brachial plexus, is similar to when you have a fast food craving. You look for the golden arches. So we see here musculocutaneous, median, and ulnar create this M sort of orientation, a golden M, similar to what you would see at McDonald's. So, in order to identify the brachial plexus, try and find that golden archway, and then trace it back proximally to the other structures that we just talked about. Now, before we can conclude our talk, we have to talk about a number of additional nerves that come off the brachial plexus. So we're not done yet. We got our way to the terminal branches, but now we're going to finish completing the picture by showing a number of other additional branches that come off the brachial plexus a little bit further up. First, we have a small branch that comes off of C5 up here. This is our dorsal scapular nerve, and it's responsible for supplying the rhomboid muscles that we've identified along the back, and a little bit of variability here, but it typically does also supply a bit of levator scapulae, which also receives some additional innervation as well. Second, we see another coming off of C5, and notice that I'm putting this one in yellow because it typically travels behind the remainder of the brachial plexus, similar to what we saw on the posterior cord. So it travels behind the other roots and trunks, and as it comes down, it also receives contribution from C6 and C7 as well. Now, your textbooks will always talk about the C7 contribution, but if you look at more in-depth texts, they sometimes will tell you that this is a little bit more variable, and in a large percentage of the population, you will not see a C7 contribution to this nerve. Our long thoracic nerve. It's going to continue along the lateral aspect of the thorax, and it will supply the serratus anterior muscle. This one, if it becomes injured, you'll typically see this because of my passion for hockey. You see this a lot in hockey players if they go into the boards and their stick gets caught between the boards and jams up in their axilla. It can sometimes sever the long thoracic nerve. It results in a condition of serratus anterior paralysis that we call scapular winging. And when these individuals put their arms up against a wall, you can actually see the scapula pushed away from the back aspect of the wall because of that injury. In addition, we already see the next line that we're going to identify, which has come off the superior trunk as well. It is our suprascapular nerve. And this nerve as the name applies, travels along the top of the scapula through the scapular notch. You've probably heard the term Army over Navy because the artery travels over top of the transverse scapular ligament, whereas the nerve here travels underneath, and then it runs into the supraspinous fossa, wraps around the lateral border of the spine, and enters the infraspinous fossa. From there, based on its orientation, you can probably guess it's going to supply the supraspinatus and infraspinatus muscles. Next, we have an additional branch that comes off the superior trunk. This is known as the nerve to subclavius. I don't think I need to point out what this nerve actually does or where it goes. That takes us into the chords. So you notice nothing else really happens in the divisions. They look complex enough, so let's just leave them alone. But what you see when you get to the chord level is there's actually a small little interconnection between the lateral and medial chords. And we see two nerves come off of this area. First, we have what's called our lateral pectoral nerve. This one will run a bit anteriorly. It will come across the medial border of pectoralis minor, but not actually pierce it, and it'll enter pectoralis major. So its innervation is exclusively to pectoralis major muscle. In addition, we have a branch that comes off of the medial cord portion of this interconnection known as the medial pectoral nerve. This nerve actually does pierce pectoralis minor and provides its innervation. And in addition, when you look at pectoralis minor, you'll see 2 to 3 sub-branches of this nerve that continue directly through on into pectoralis major. So that means medial pectoral nerve supplies both minor and major. Something else to point out at this stage, because it might have created confusion when you looked at these structures in the thorax, is that the lateral pectoral nerve, I did not say it wrong, it actually does travel along the medial border of pectoralis minor. So what that means is when you've probably first encountered these before you even saw the brachial plexus, you would have seen these in the body and you would have noticed that the lateral pectoral nerve lied medial to the medial pectoral nerve, which can create some confusion. But now hopefully you'll observe that the lateral pectoral nerve gets its name because it really is associated with the lateral cord where it first comes off of. And in fact, where it first starts, it is in fact lateral to our medial pectoral nerve. But this can create some confusion until you actually get to these structures themselves. Next, we look at a couple more branches that come off the medial cord. The first one is known as our medial brachial cutaneous nerve, and the second one is our medial antebrachial cutaneous nerve. As the names imply, these are cutaneous innervations to the arm and the forearm, respectively. I show them here with the brachial coming out a little bit proximal to the antebrachial, but really to safely identify these in the laboratory, you'd have to be able to trace them to their destinations. You notice the brachial is smaller and much shorter since it only goes to a smaller area. Antebrachial, that's the one that's going to travel all the way into the forearm. If you can't see where those branches are actually going to, it's very difficult to actually make that distinction between them, and you wouldn't be asked it for a test. Last 3 branches that we have to talk about all come off the posterior cord in order. I'm showing the first one being a little bit shorter. That's just for labeling purposes to eliminate confusion, but keep in mind that these all will extend down a fair ways. What we see is the first one that comes off is known as our upper subscapular nerve. The one that comes off in the middle is known as thoracodorsal, and the third branch is known as lower subscapular nerve. Upper subscapular nerve, as the name implies, runs into the subscapular fossa where it supplies the subscapularis muscle. Thoracodorsal nerve, if you come across it before, this is the one that is going to travel down the posterior aspect of the thorax, and it is going to supply the latissimus dorsi muscle. Finally, we have lower subscapular nerve, which, as the name implies, also runs into the subscapular fossa. And from there, it also supplies some of the innervation to subscapularis muscle, and it also provides a bridge which goes directly to teres major muscle. Now, at this point, we've got the completed structure of the brachial plexus. And if this is the majority of what you wanted to take a look at, you're pretty much done. But it is important to also consider nerve root levels. And the nice thing is once you have the completed picture, it's just a hop, skip, and a jump to understand root levels. Basically, think of the brachial plexus as a flowing stream. And the idea of innervation coming from the roots to the trunks, divisions, cords, and branches, and that everything typically travels downstream and not the other way around. What this means is we can take a look at some of these nerves, and based on where they're actually coming off of in the brachial plexus, we can predict with a certain degree of accuracy what root levels are going to supply it. For example, let's take a look first at the dorsal scapular nerve. If you look, this twig is coming directly off of C5, which means if we go upstream, we only see C5, nothing else. In order for another root to be able to contribute to dorsal scapular, they would have to come to the fusion point and then backtrack. That typically is not seen. So consequently, we would predict that the only thing which is going to contribute to dorsal scapular is C5. We would be correct. Dorsal scapular nerve is 100% supplied by C5 root level. If we then start to look at suprascapular nerve, notice that suprascapular nerve comes off of the trunk after the fusion between C5 and C6. So if we go upstream, we have this forking that allows us to travel either through C5 or through C6. And we might want to predict that the suprascapular nerve receives contribution from both C5 and C6. And once again, we would be correct. Same thing with the nerve to subclavius. If you look at the nerve to subclavius, it can be traced back to both C5 and C6, but no other root level. And we see once again that the nerve to subclavius receives contributions from both C5 and C6. Long thoracic nerve down at the bottom, we trace it back and we see that it directly attaches to C5, C6, and C7. And as you might expect, it receives contributions from all of those root levels because it's physically attached to each of them. We go out a little bit further, so we're going to skip a couple. And we're going to go down to lateral pectoral nerve. Let's see where that one comes off of. Lateral cord, which can be traced back to the anterior superior division, which receives contributions from C5 and C6. But we also have this branch point here, so we can also trace it back to C7. And as expected, lateral pectoral nerve receives branches from C5, C6, and C7. Medial pectoral nerve. Let's trace it back. It comes back to the medial cord, which has a single branch point that traces it to C8 and T1. As expected, the contributions to medial pectoral nerve are C8 and T1. Let's look down here at musculocutaneous nerve. We trace this backwards to its branch point, and we see once again it should receive contributions from C5, C6, and C7. We wouldn't go up into this region because this would be considered upstream, so it should just be 5, 6, and 7. And that's exactly what's happening. So for the majority of these nerves, or for a large portion of these nerves, we can accurately predict just by tracing its origin in the brachial plexus exactly which root levels are going to contribute to them. This has significant clinical importance in that with different types of nerve injuries, you can accurately predict what structures would be affected and which root levels they could be able to be traced back to. A very important skill to have. There is some variation in this, and what you will notice, certain textbooks, when they list the root level contributions, they will say that there is variable contributions from certain root levels. For example, let's look at the ulnar nerve down here. Now, if we do the tracing, we'll see that it can be traced back to C8 and T1. In practice, however, you'll notice that I have 7 put in a faded color here, which represents that occasionally the ulnar nerve can receive contributions from C7 as well, depending on the variability in the brachial plexus. Another example of this is in the median nerve. Median nerve we can trace back basically to every single one of the root levels, 5, 6, 7, 8, T1. In practice, however, we find that there's a bit of variability in the C5 contribution to the median nerve. Sometimes it's there, sometimes it's not. Same thing with radial nerve. We can once again trace it back to 5, 6, 7, 8, and T1. All of them should be giving contributions to radial nerve, but in this we see a little bit of variability in the T1 root level contribution. Now, in addition to these variations that we see, there is a series of the 5 nerves remaining that are a little bit less predictable. You can trace them back, but they're not always going to receive the contributions that you would expect in this tracing process. And these ones, you just have to remember these variations. First is our axillary nerve. Again, we can trace it back to the posterior cord, and realistically, we would expect, using the tracing pattern similar to radial nerve, that it would receive contributions from every one of those root levels. But in practice, we only see C5 and C6 actually contributing to the axillary nerve. So the contributions from C5 and C6 will remain bundled even when it fuses with the posterior cord, and those are the ones that exclusively make up the axillary nerve. Next, we can look at the medial antebrachial cutaneous nerve. Now, we trace this one back, and we would expect to get root level contributions from C8 and T1. And this is one that's actually more predictable. In fact, it does receive, as expected, contributions from C8 and T1. If we look at the medial brachial cutaneous nerve, however, when we trace it backwards, we find that even though it can be traced back to C8 and T1, it only actually receives its contributions from T1. So this is another one of these cases where you just have to remember that medial brachial cutaneous nerve is an exception to the tracing exercise. That takes us to our upper and lower subscapular nerves. Once again, a little bit unpredictable, but the nice thing is both of them have the same unpredictable pattern. In both cases, even though that they can be traced back to every one of the root levels, we find this, they only receive contributions to C5 and C6. Notice that's very similar to what we see for axillary nerve. So all 3 of these can be thought of as a C5-6 exception. Finally, that leaves us with our thoracodorsal nerve. Once again, we would expect C5 through T1, but in practice, we see an unusual pattern here of C6, 7, 8. So the 3 middle ones, but it excludes C5 and T1. So the exceptions to the rule are ones that you just have to be aware of, and in those cases, it really requires a bit of memorization. But the additional root levels, you can use the tracing exercise and answer with a certain degree of predictability exactly what root level contributes to which nerve. So, if you've been paying attention, you will notice that we have once again just recreated the first slide I showed. And I'm hoping it doesn't look nearly as scary now that you had an opportunity to draw it out yourself. I would strongly encourage you to do this multiple times. It doesn't take that long when you really get down to it and get to the point where you can actually draw the entire brachial plexus like I've got up here without any sort of direction whatsoever. It actually doesn't take as long as you think. Run through it about 3 or 4 times. You might be actually at the point when you're able to do that. In addition, you'll notice that we did include a lot here, but you may not always need to include all of it. For example, when I put in the root levels in red, that might not be necessary for your test. So you can just go back to the specific parts of this podcast that apply to what you really need to learn and to help you with your study. That concludes this installment of the BBS Gross Anatomy video podcast series. This has been Dr. Stuart Ingalls. Enjoy the rest of your day.